Okay, so this video will be about the O2 administration. So first, what I'm going to do is check the doctor's orders. So here I have the doctor's orders for oxygen therapy at 5 liters for Miss Carla Garcia, date of birth May 20th, 1979. I'm going to check her allergies, no known allergies, contraindications, no, like COPD, she doesn't have it. That would only be like 2, no more than 3 liters. So first what I'm going to do, come in, knock. Hi, my name is Laura. I'm going to be your student nurse today. May I have your name and your date of birth? Carla Garcia, May 20th, 1979. Let me check your ID bracelet. Okay, that's good. Okay, so let me just film in. Check the bed that it's locked. So right away I'm looking at the cardiac monitor. The O2 stats are kind of low. I'm gonna observe the patient. The patient looks a little bit pale, restless, slightly confused. These are all indications that they do need oxygen. I'm gonna listen to the breath sounds right now. Take a deep breath in. Again. Again. And again. Okay. Pulse right now. Strong. Heart rate's in the 80s. Good. O2 stats are a little low. 92 to 93%. Okay, so first what we're gonna do, the orders did say 5 liters. So anything 4 liters or greater will require to have a humidifier with distilled water going on as you're giving the oxygen. The way that you know the humidifier is working if it's bubbling inside. So we're gonna do first, for the nasal cannula, you're gonna insert them prongs down. But first I'm going to connect the nasal cannula to the oxygen, turn it up, and make sure the little metal ball is up to the 5 liters. I'm going to test it first to see if the air is coming out of the nasal cannula, of the prongs. Then I'm going to put it up into the patient's nares, put it up behind the ears and around the neck. I'm going to tighten it just so it won't be falling off. And then I'm also going to put some gauze behind the ears just for comfort. The next time I would connect the humidifier, make sure it's on and bubbling going on for anything that's 4 liters or greater. That is for the nasal cannula. Then next I would observe for increase in O2 sats, back to normal color, rosy, and then they're not restless anymore, they're not confused. How are you feeling? Are you breathing better? Does the oxygen help you? Yes? Okay. They're less anxious, they're answering questions faster. Okay, that's for the nasal cannula. Now for the face mask. Just a simple face mask. I've created one here. For that, I would first connect it to the oxygen provided on the wall. And I'm gonna go ahead and turn it on to 5 liters. Turn on to 5 liters, make sure the metal ball inside is at 5 liters. I'm gonna make sure the air is coming out of the mask. Yep, before I put it on the patient, make sure it's working. I'm gonna go ahead and put it on the patient. Okay, anything over 4 liters, you do have to put the humidifier connected to the wall to make sure it's working, it's bubbling the whole time. I have to make sure that distilled water is always filled. And then I'm going to observe the patient again. I'm going to look at their vitals, make sure they're good, make sure they're normal for that patient. Make sure the O2 sats are up. They're beginning to go up. They're at 97% now. That's a really big increase. As I'm talking to the patient, they are understanding me. How do you feel? Do you feel better? Breathing easier? Yes? Okay. Relaxed. It helps helps you get rid of your anxiety. Yes, okay, good. And their color is going back to rosy. The mucous membranes are not dry. They are moist. I'm gonna go ahead and assess again the respiratory sounds. Take a deep breath in. Out. Again. Again. And again. Yep. Sounding better. I'm going to be sure to place the oxygen in use sign outside of the patient room. And also teach the patient not to be smoking while they have oxygen because it could cause an explosion, and not to increase their oxygen by themselves because that could cause some side effects. That if they have trouble breathing, then I'll come in, I'll assess them first, and then determine if I should raise it or lower the oxygen, but I'm going to do that. They cannot touch the oxygen. And I'm going to make sure to document everything, make sure to document their vital signs before and my assessment. And I'm going to document how they appeared after the oxygen therapy. Skin color was pink, wasn't pale anymore. They weren't confused, they weren't restless anymore. They said they were breathing much better. Their vital signs improved, the O2 sats improved. The respiratory assessment sounded way much better. And that's about it. Thank you.